Hi, my name is Steve Udelhoffen. I'm a board-certified general surgeon and fellowship-trained bariatric surgeon. I am the medical director of the Mercy Iowa City Bariatric Surgery Program and also participate in their general surgery. So the American Society of Metabolic and Bariatric Surgery, their statement is that the average patient lives 10 years longer after weight loss surgery. But not only that, they frequently have a reduction or a cure in chronic comorbidities such as diabetes, high blood pressure, sleep apnea, which are commonly thought of, but also a reduction in cancer risk, a improvement in fertility rates, reduction in urinary incontinence, and joint pains and back pains. The National Institute of Health criteria for qualifying for weight loss surgery is a BMI of 35 with a comorbidity of diabetes, high blood pressure, or sleep apnea, or a BMI of 40 without a comorbidity. If a patient does want to proceed with weight loss surgery and their BMI is less than 35, they still have an opportunity to proceed. The average patient would come in for an initial consultation. At that time, we'd have to review your history and go over your options. One of the exciting things about bariatric surgery is it's an evolving field. And so the traditional surgeries such as a sleeve gastrectomy and a gastric bypass are still really good options for a lot of patients. But there are emerging options such as medical weight loss, gastric balloons, endoscopic sleeve gastroplasties, duodenal switches. There's a lot of options. And so the first thing we want to do is go through those options and pick what's best for the patient. Once we do that, then we need to look at criteria. Typically, a patient needs to complete a 3 to 6 month supervised diet program depending on their insurance type. That does vary, and some insurance companies do require up to 12 months of therapy. Everyone is required per the ASMBS, American Society of Metabolic and Bariatric Surgery, to get a psychiatric screening evaluation. And then based on your medical history, we may want to proceed with other testing prior to surgery to make sure it's safe. Post-operative care follow-up is at 1 week, 1 month, and at least every 3 months thereafter. However, I believe that the more frequently a patient follows up, the better their results are, and I encourage them to follow up monthly so that we can provide both ongoing dietary therapy and medical therapy if needed. The Mercy Iowa City Bariatric Program is accredited by the American Society of Metabolic and Bariatric Surgery, and we are accredited as a center of excellence. We always do every surgery as safely as possible. So to that end, we optimize medical therapies before proceeding with surgery. We complete the appropriate preoperative testing. And then we always work with the patient to schedule, their surgery conveniently for them to keep the other things in their life in order.